So good afternoon. The Department of Public Health reported test results for 11,276 new individuals. That brings the total number of tests that have been administered in the Commonwealth to almost 1.75 million. There were 214 new positive cases reported. In total, there have been 112,673 cases statewide, the vast majority of whom have recovered. The 7-day positive test rate percent is 1.8%. That latest 7-day average has dipped back below 2%, but as we discussed last week, we've been seeing an uptick in COVID-19 in various communities across Massachusetts. There are 380 patients hospitalized for COVID-19, and of that, 60 are in the ICU. The 3-day average number of patients hospitalized, as most people know, is down 90% since the middle of August, and currently there are no hospitals using surge capacity. Last Friday, we announced some new measures to address the uptick in cases we've seen in parts of Massachusetts. Part of that strategy involves tailoring it to specific communities where the data indicates there's significant community spread concerns. Today, we're making available to all cities and towns enhanced community-by-community level data to better direct state and municipal resources. The good news is the vast majority of the communities in Massachusetts are experiencing low COVID case numbers, and most are seeing trends that are moving in the right direction. In our most recent town-by-town report, our public health data shows that 318 communities have low numbers of new cases, 4 or less, or under 4 per 100,000 people over the past 2 weeks. This measure, this 100,000 people measure, is the one that's used by many other states to measure community health under COVID-19. However, there are about 33 communities in Massachusetts that had more than 4 cases per 100,000 people during the previous 2 weeks of testing. These communities require specific strategies to attack COVID there and to work with them to stop the spread. In the end, working with our colleagues in local government is our key strategy in developing solutions to unique challenges that they face. Every community is different, but this could include additional testing, tracing, and isolation resources, and we're also implementing stepped-up enforcement measures, and we'll also work with these communities on messaging and other communication strategies as we and they see fit. The Lieutenant Governor and I reached out to all of these communities in the past couple of days because we want to partner with them in whatever way makes the most sense to help them deal with the spread in their communities. We also need to ensure that the businesses and individuals in those communities are aware of the level of COVID that exists in their communities and what would be required of them to help control it. To accomplish this, we're releasing a map today that's based in part on case counts in every town, and will be updated on a regular basis going forward. Using public health data, the command centers created a color-coded ranking system to show a community using typical traffic light colors as red, yellow, green, or white. Red obviously indicates municipalities that have more than 8 cases of COVID per 100,000 people, and this is based on a national and global public health standard that's extremely high risk for COVID infection. Yellow indicates municipalities between 4 and 8 cases per 100,000 people, or a moderate level of risk. And depending on the community, there could be areas where trends are moving in the wrong direction, although in about half of these communities, we've seen downward trends for the past 2 or 4 weeks. Green indicates municipalities with less than 4 cases per 100,000, and white indicates less than 5 total cases of COVID-19 reported in the most recent 14-day period, the lowest number of cases here in the Commonwealth. Secretary Sutters will share more on this methodology in a minute. I want to be clear on one point. Regardless of where your community sits, COVID is not going away. Your actions, no matter where you live or where you work, will determine in many respects whether and how this virus spreads. The Lieutenant Governor and I have reached out to all of the municipal leaders that are in the communities that rank in either the high risk or moderate risk category to start a dialogue on how we can offer state support and a variety of resources to help them work to reduce COVID in their communities. Lieutenant Governor will talk more about that in a minute. As I said Friday, our administration is ready to provide assistance to enhance outreach and enforcement and messaging efforts, as well as additional public health resources and public awareness strategies in these moderate and high-risk communities. And we're asking everyone to recognize that this virus continues to affect, injure, and kill people every single day. In the high-risk communities, residents need to be aware, first of all, that they are in a high-risk community. For everyone in these communities, we're advising everybody to start with the perfect assumption that you need to do all you can to keep your family and yourselves safe. Wear a mask if you go out. Wash your hands. Engage in the basic hygiene strategies that we've all talked about for months. Avoid large group gatherings. And while it may be difficult, find a way to be a little less familiar with the people with whom you are most familiar outside your family. On Friday, we unveiled new statewide guidelines and introduced a COVID enforcement and intervention team, which is a concept we plan to discuss with many of our colleagues in local government. That team will be a key resource to assist local officials as we work with them on a COVID-19 response. They'll be charged with two main tasks: ramping up enforcement statewide and coordinating local intervention efforts that will make the most sense in each of these high-risk and moderate-risk communities. The team will provide different resources in different communities, but it could include a number of things, including helping towns access additional federal funds. They'll likely offer significant assistance to ramp up enforcement in places where it's needed, especially when it comes to dealing with some of the issues associated with bars and restaurants, and also issues associated with what in many cases represent local orders around face coverings and gatherings. Some of these higher risk COVID communities may also see restrictions or shutdowns with respect to parks, playgrounds, some businesses, or other entities that are determined to have been part of the issue with respect to the spread based on contact tracing and other conversations. The purpose of mobilizing an enforcement and intervention team and implementing more statewide guidance is to provide public awareness and to change behavior. Coordinated by the Massachusetts Emergency Management Agency, along with the Executive Office of Public Safety, we're bringing together multiple state agencies, including the Division of Local Services, the Department of Public Health, the Division of Labor Standards, the Alcoholic Beverages Control Commission, and the State Police. The team will coordinate an increased enforcement effort across the state to ensure that businesses and residents are aware of and following the COVID instructions in each community. As we said last week, state and local police are now authorized to enforce these orders and to help local officials enforce face coverings, gatherings, and other orders, both state and local, more comprehensively. For example, enforcement's already begun at Logan Airport and Worcester Airport. Yesterday, Massport began a travel ambassador program at both airports. Massport employees will serve as ambassadors to provide information to arriving passengers about the Commonwealth's travel order and how to access the online form on mass.gov. The team greeted many passengers arriving from higher risk communities, cities and states, and on international flights. The good news here should not get lost. Over 318 communities here in Massachusetts are at or below national benchmarks with respect to containing COVID in their communities. But we still have work to do in Massachusetts. We want to help parents, families, and individuals make smart decisions about their daily activities. We're asking families in moderate and high-risk communities to avoid having big play dates and avoid big gatherings with multiple neighbors and friends, and to wear face coverings, and to be conscious of all the rules and the guidance that have been provided by the Commonwealth and by your local boards of health and by your local communities over the course of the past few months. People need to step up and be aware of the level of spread in each community, and especially in your own area, and to be vigilant. The virus doesn't care about boundaries, and it certainly takes every opening any of us give it. We're making progress and have made progress in our fight, but we have seen the effects of too many people letting their guard down and simply relaxing get in the way of some of our continued move forward. We can continue to reopen Massachusetts and get back to something like a new normal, but only if everybody continues to bring their fight to this virus. In many respects, we know what it takes, but we need to do it to get the job done.